More than 15 years since the launch of the Safe Motherhood Initiative, maternal and neonatal mortality levels in Africa, Kenya included, have continued to rise instead of decline. This worrying trend has shed light on the potential of electronic health solutions to strengthen health systems in low and middle income countries, and this is where the smart paper technology comes in. Plan International is currently implementing the Shifo smart paper technology in Lunga Lunga Sub-County Hospital.
Smart paper technology in Kenya that we are doing now is a hybrid program which uses paper as a technology. After recording on this paper, the paper is scanned, the system digitizes the paper, and then there is automatic generation of reports. And one thing that I want to go without mentioning, that the care that a mother receives when pregnant and at the point of delivery and the service that is offered also determine whether the child will survive and live or the mother will survive also or live. So in terms of matters dealing with maternal morbidity, child morbidity, maternal mortality and child mortality, we are implementing this to increase cover and just to reach every mother and child in this nation. So we are starting in Lunga Lunga now. We have already set up a scanning center. We've started rolling out the smart paper forms, and we hope that after this we'll be able to scale up to other counties.
On the first visit, a unique ID to be used for the entire gestation and immunization process is given. The services offered are recorded on the smart paper form, after which the papers are taken to the data scanning center.
This is the data scanning center. The process of data scanning, we start by scanning the papers. After scanning, we go to the second process for verification, which takes around 5 minutes when the network connectivity is strong.
Within just a few months of operation, the health workers are already terming the smart paper technology a blessing.
The turnaround time has markedly reduced, so that we realize that now more patients are more comfortable to come to our facility. There has been an increase in the number of mothers who bring their children to our facility for vaccination because they know that we spend less time, doing the clerical work and stuff.
Most of the time, because we have one nurse on duty in Lunga Lunga Hospital due to shortage, this could take her the whole day immunizing. But currently, by noon, she has done the same workload that could have taken her the whole day.
Some of the benefits for the smart paper technology that we've experienced as a facility is the fact that there is a reduction in clerical work. There are few records that need to be taken. The books that we use to write down the names of the patient, their details, there were so many. So currently the bulk of work has been markedly reduced such that now the nurses do more. They spend more time with the patients.
The system generates automatic reports that are accurate and consistent, reducing the aspect of misreporting.
We want an accurate data that can inform action. So for this, the Ministry of Health may be able to even initiate action based on what comes from the system. And about the data also, I want to say that at the end of it all, you are able to have like an accuracy in terms of making a decision. So decision is well informed, and what comes from the system is very reliable.
Effective support strategies have also been put in place to make the program a success.
At the end of every month, we're able to know the children who missed their vaccinations. So in that case, we then we call them, and because we also pick where they come from, their residents, we are also able to visit them, do an outreach, and make sure that they get these important vaccines.
For those who are having phones, Shifo has done us an excellent job that mothers are being reminded that they should bring their children to clinic 4 days before the actual time, which is very good.
However, there are a few challenges facing this technology in Lunga Lunga Sub-County Hospital.
There are a few patients who have been double registered. So sometimes double registration will come in that the mother comes back, the nurse cannot remember all patients physically. They have lost the book and they come as if they are reporting to the clinic for the first time. So that is when double registration is coming about. So, or maybe someone will come, they think that the booklet from the other hospital cannot be accommodated in our hospital. So they will say that, mimi sijachanjwa.
As we continue with this, we are seeing this project moving to another level where we'll be able to network all hospitals, we'll be able to have all facilities having this system, so that we network and see how we can be able to capture fully immunized children. Because when a child comes to this facility, they are recorded into the smart paper forms, and then the digital system goes in. But when they seek for health services in another hospital, it becomes a bit hard to track whether they have a missed opportunity or not. This system also is able to print out the default list of all the children who missed an opportunity, the viable vaccines that they are supposed to be receiving. So at the end of it all, we engage the public health sector just to follow up, because the details of the mother and child is there. The village where they come from is there, the phone number of the parent, and also the locality. So with the community health unit structure in Kenya, each household is now covered by a healthcare volunteer. So these healthcare volunteers are able to help us in tracing those who missed an opportunity to be followed up to get the essential immunization services.
With such efforts, we are truly marching towards the day when every child will be fully immunized and no child will die or suffer from preventable diseases.
It has been very beneficial to us as a facility, and we hope that in the near future it should be upscaled to the whole county and country.
At this level, we are in the verge of enhancing the system and upscaling it. So in case of any funding that may come our way in the near future, we'll be able to move out of Lunga Lunga Health Facility and move to the rest of the parts of Kwale, and then just document a case for moving into the entire republic.
Let's march together.